This is CGTN, China Global Television Network.
Nigerian government says recent rise in deaths in Kano state are not linked to the coronavirus. Limited government spending hampers growth in Africa's health sector. And UK Prime Minister expected to announce lockdown easing plans as ministers say battle is far from over. Hello and welcome. You're watching Africa Live. We're coming to you live from Nairobi. I'm Hannah Viviers. Here are more stories making headlines this hour. In business news, Egypt's central bank eases restrictions on cash withdrawals. And in your sport news, African football in limbo as COVID-19 continues rapid spread. We begin in Nigeria, where there has been a sharp rise in deaths in the city of Kano. Last week, the Daily Trust local newspaper reported 150 deaths. But after a preliminary medical investigation, the state government says the deaths were caused by complications from other health conditions such as hypertension, diabetes, meningitis, and acute malaria, and were not caused by the new coronavirus. Kano State has become the epicenter of the pandemic in northern Nigeria. The region has 77 confirmed COVID-19 cases. Well, let's now look at the latest figures on the COVID-19 pandemic. Across the world, confirmed cases are approaching 3 million, with the death toll topping 200,000. The U.S. recorded more than 1,000 deaths in a single day, bringing the total to almost 55,000. Nearly half of the world's cases are in Europe. Spain reported fewer than 300 deaths on Sunday, the lowest in a month. Italy recorded more than 2,000 new cases. In the UK, total cases are approaching 155,000. On Sunday, hospital deaths passed 20,000. Turkey has seen infections top 110,000, while the Chinese mainland has confirmed 3 new cases. 2 were people who had returned from abroad. Meanwhile, in Africa, the number of infections have been gradually rising. The continent has recorded more than 31,000 cases with nearly 10,000 recoveries. Egypt and South Africa have each announced more than 4,000 cases. Lesotho and the Comores have not recorded any case. Some experts say the continent seems to be suppressing the curve so far. Several governments have stepped up response measures to limit widespread infections. But some are also easing these restrictions as the measures begin to show signs of severe negative impact on the economies. South Africa plans to lift its lockdown from the start of May. Well, let's go back to that top story from Nigeria, where there has been a sharp rise in deaths in the city of Kano. And last week, the Daily Trust local newspaper had reported 150 deaths. But after a preliminary medical investigation, the government state says the deaths were caused by complications from other diseases and not COVID-19. We now have our reporter live from Abuja, Phil Ilhaza. Phil, thank you so much for joining us. Bring us down to the latest on what's happening in Kano State, Phil, because investigations are underway to find out the cause of increased deaths in Nigeria's Kano State. What more can you tell us, Phil?
Well, thank you, Hannah. What we know at the moment is that, the Commissioner of Health in Kano State, that's in northern Nigeria, has revealed that preliminary results from the investigations conducted by the Ministry of Health shows that the deaths, hundreds of deaths, according to him, in the past one week, over 600 people, about 640 people have died. But the cause of those deaths, according to the preliminary results, show that it is as a result of complications from meningitis, hypertension, acute malaria, and not directly from COVID-19. And so that's how far we know at the moment, which has gone a long way to douse the concerns and doubts and tensions that has risen in the past few days or weeks as a result of the what people saw or called as mysterious or strange deaths that has been occurring in the state.
Phil, I guess one of the questions some may be asking is why so many deaths suddenly from the same area? What are authorities saying to that?
Well, okay, so looking at the state Kano in the northern part of the country, Kano is the second most populated state after Lagos in the country. It is also the most populated in the northern part of the country as well. Then we also know that in the past 1 week or so, there's been lockdown, there's been restriction of movements. According to the health officials, people are not able to gain access to medical facilities to get treated or even tested for whatever sickness or ailment as the case may be. So the health officials are saying that may also be the reason for such a state, or such amount of deaths caused by these complications from other diseases. You would recall that, as I was trying to explain earlier, Kano is now also the epicenter of the disease in the pandemic rather in the northern part of the country. That's because of how populated they are. They also live in nucleated settlements where they're mostly closely knitted, so I mean the places of worship, people are actually, there's a lot of people in Kano, so one outbreak of any sort can lead to this number of deaths. So, but until the investigations are concluded, we'll be able to really point out whether it's as a result of COVID-19 or these other complications like the health officials have already started revealing in the state.
Okay, Phil, so the Nigerian Health Ministry says the situation is being monitored closely. What else is the government doing, also in light of media reports stating that Kano has shut down private hospitals and diagnostic centers over the high mortality rate? And you've also spoken a little bit about that in your previous answer to us.
Yes, so apart from the fact that, yes, medical facilities, mostly some of them, especially private hospitals, have been shut because there were reports that health officials were exposed to COVID-19 cases because they were not properly trained or properly kitted with the PPE, the personal private equipment, the health equipment that the health officials are supposed to put on to test for cases. And so the federal government had to step in, from the Ministry of Health, the task force, the federal government task force set up to look into the COVID-19 control in Nigeria. So they had to shut down most of those facilities. Also, the government has gone ahead to fumigate those places where there may be high risk of contracting the disease. That fumigation is done at the moment. The ministry or the health officials are supposed to open the test, for example, the laboratory center, today, which is a Monday, and also then allow for health officials to be well kitted and then go ahead to attend to people who need help, whether it's COVID-19 or any assessment as the case may be.
Phil, I would imagine with everything that is happening that people in Nigeria would be a lot more concerned than usual, especially with the reports that are coming in now. But how are Nigerians reacting to reports of these recent deaths?
Well, Hannah, it's been mixed feelings here in Nigeria, especially with the fact that, like I said earlier, Kano is highly populated, the second most populated state in the country. So people have actually been praying and hoping for COVID-19 not to get into the state. It took a long time for that prayer to be answered, but unfortunately, as at a week or so, the first case was recorded, and to prove to you that indeed the state is populated and has a high risk of spread, in less than a week or thereabout, we already have nearly 80 cases confirmed in Kano. Now that's also because the testing, the laboratory test center has been closed temporarily. It's supposed to be reopened. So imagine the number of cases that may come up once those test testing, kits and officials resume. So that tells you that people have been concerned. People are still not believing the reports given by the government and health officials that the cause of these deaths may be linked to other diseases. But I know that once the investigations are concluded and made open to the public, it will douse tensions. But the hope is that the federal government, do more to contain the spread of the disease, especially in states like Kano, where where there is high risk, actually.
Thank you so much, Phil. I suppose right now the big thing is to not speculate until those investigations, as you say, have been completed. Thank you so much, Phil. Phil Ihaza joining us live from Abuja, Nigeria. Well, starting today, we will be looking at how African countries are dealing with the coronavirus. We start by looking at how the pandemic has affected the health sector and what has been the response across the continent. The World Health Organization has warned that countries with weaker health systems that have historically struggled to contain infectious diseases outbreaks in the past, many of which are in Africa, could significantly struggle from the spread of COVID-19. Well, public health systems across the continent are often described as fragile, with limited healthcare spending and personnel. Private sector players barely fill the gap. CGTN's Ramanyang explored how African governments got to this point.
Now, as is the case with many other things, this mostly comes down to how willing or not, as you're about to see, governments are to properly fund public healthcare systems. So let's start at the very top. You see, at the very start of the century, African governments agreed to spend no less than 15% of the national budget on healthcare by 2015. But by 2014, only 4 countries had either met or exceeded that spending target. 18 others were somewhere middling around 10 to 15%. Now, to be clear, it wasn't that total healthcare spending had fallen. It's just that that particular target had not been met. So take Kenya, for example. Between 2014 and 2015, when the Abuja Declaration should actually have been met, and last June, total spending on healthcare more than doubled. It went from $1 billion to $2 billion. But even at these levels, it's still woefully insufficient. As a percentage of total government spending, healthcare was about 5.7% on average across this entire period. At the same time, though, the question is, okay, so where's the money going, right? In the last 2 fiscal years, Kenya has spent 4 times as much on servicing debt, both foreign and domestic, compared to its public healthcare system. And it isn't alone in this respect. In 2017, Ghana spent 5 times more on debt service than it did on healthcare. Nigeria spent 3 times as much, according to Bloomberg data. So clearly, because of government spending priorities, there's simply no fiscal room to build out a functional, efficient public healthcare system. And this also explains why the calls for debt relief are coming up in the case of this crisis. All right, then, so that's where the public money is going. But when governments can't, or as you've seen, choose not to spend properly on public health systems, the cost burden then falls on African citizens. According to the WHO, out-of-pocket payments more than doubled between 1995 and 2014, from about $15 per capita all the way to $38. At least 60% of healthcare costs are paid directly by citizens from their limited income, and it often comes at a very steep cost. According to the WHO, 11 million Africans fall into poverty every year just because of medical costs. Some countries have tried to set up national health insurance programs of one kind or another, but coverage is often patchy at best. Nigeria, for example, set up a national health insurance scheme in 1999. Operations only started in 2005, and by end 2016, barely 4% of the population had actually subscribed to it, and participation isn't mandatory. In Kenya, a comparable system covered roughly 18% of the population in 2015. And South Africa, home to the continent's most advanced capital markets, it only started its national health insurance scheme in 2012, and it's got a 14-year rollout as well. Private medical insurance plans, as a comparable proxy, cover roughly 16% of the population. So if you put all of these factors together, the poor and often wasted funding levels, the massive lack of coverage for a significant chunk of the population, the scarce infrastructure and equipment, and of course a shortage as well of trained medical personnel. And it's clear why many African countries are simply not prepared for a pandemic on this scale. Back to you.
Well, meanwhile, some African countries are leveraging their capacity to test for COVID-19 as one of the ways of investing in their health systems. CGTN's Daniel Arab Moy visited a football stadium turned into a temporary hospital some 40 kilometers east of the Kenyan capital, Nairobi. It has been set up as part of measures to fight COVID-19.
Frontline healthcare workers and officials in Kenya's Machakos County are turning the local stadium into an isolation facility. Doctors and nurses assemble ventilators and other equipment in readiness for the worst, a possible sharp rise in confirmed COVID-19 admissions.
The Stadia facility and the other 122-bed facilities in our various facilities is going to help us to curb the virus. So we are just planning ahead. So far we don't have a case, but we don't know what will happen tomorrow.
This makeshift facility hurriedly assembled to deal with the dire situation.
If we see numbers are increasing, we'll be able to set up 5 more tents within that stadium to increase the number from 60 to 300 beds. It's doable, and it is a quicker and cheaper way of rather than setting up a whole hospital or destabilizing an hospital to make it a COVID-19 exclusive.
We've had several leaders coming up with structures in order to curb or to prepare itself for the coronavirus victims. We want to, the only thing we can do as residents is to support the initiative.
At the main hospital in Machakos, an oxygen supply system has been set up for those who might experience shortness of breath. The goal is to continue its usual services under unusual circumstances.
Coronavirus has put an immense strain on Africa's healthcare systems, prompting governments to build new makeshift hospitals and testing facilities to help contain the spread of the virus.
The pandemic has sent countries scrambling to ramp up testing efforts while maintaining bed space for other patients in their hospitals. With the battle to contain the virus still raging, the frontline caregivers are just not about to give up, sacrificing their time, setting aside their normal lives to attend to those in dire need of medical attention. With the overwhelming healthcare challenges, African countries may need to reconsider bolstering their healthcare systems to cope with the rising infections. Daniel Arab Moy, CGTN, Nairobi, Kenya.
Well, for more on that, we're joined by Dr. Mary Stevens for more on the state of health infrastructure on the African continent. Thank you so much for joining us, Doctor. Let's just speak about how coronavirus has laid bare the state of healthcare in Africa. What are some of the positives that we can pick up from the continent's handling of the pandemic?
Thank you for having me, and good afternoon. So yes, Africa has started reporting cases sometime in February. We are seeing the outbreak evolving in the different countries differently. So all the countries have different experience in terms of the outbreak response. And some of the good things that countries have done was their ability to detect these cases early enough, to test the cases, isolate them, manage, and start contact tracing. We have also seen how governments have put measures in place to enhance the implementation of the social distancing measures to avoid exposure of people to COVID-19. So we still have a good number of countries on the continent that are still reporting less than 50 cases. And these countries, it's really very easy to curb further spread of the outbreak. And even countries like South Africa that are reporting more number of cases, it is still possible to break the chain of transmission by implementing those aggressive public health measures they already put in place to curb further spread of the outbreak.
Doctor, this sounds like always with these questions of what do you think needs to be done, usually there's so many things and so many factors at play. But what are some of the top things that you think need to be done to get Africa's health system to where it needs to be in order to tackle pandemics like this one of the coronavirus?
Yeah, so this coronavirus, some of the things that you need really, the surveillance system needs to be in place to make sure that the cases are detected early. And in some countries now, they are using what we call the community surveillance, and they are also doing house-to-house case search, what we call active case search, to find these cases to help fight the COVID-19 outbreak. And a lot of countries are also expanding the testing capacities for this outbreak. So in terms of the health systems, yes, we need the countries to enhance the ability of the health system to cope with further spread of the outbreak. So in terms of the infrastructure, the equipment, the human resource capacity that will be required, supply chain management to help enhance these capacities. But of course, in addition to capacities in the health system, we have capacities under the international health regulations, where countries are expected to enhance this capacity to help them to detect, prevent, and respond to public health emergencies.
Doctor, with what is available on the African continent, of course, different countries are dealing with this differently. And of course, different countries have got different resources in terms of how much or perhaps not as much as they should have. But with what is available, can Africa cope with the coronavirus pandemic? And I wanted to speak a little bit also about capacity, because one of the stories that we had coming out is just about how many healthcare workers are thinking of leaving the African continent. That's something that's been happening for a while. But especially with something like this, when we're talking about capacity, not just from the point of view of the technology that we have and all the different things that we need, but also the human capacity, the human resource. Speak to us about that as well, Doctor.
So for the capacities, in terms of what is available, like I said earlier, already countries on the continent are implementing what we call the integrated disease surveillance and response. This is a strategy we have on the continent and has been implemented for the past 20 years. And this is the same strategy we use for detection of every kind of outbreak, of course, including COVID-19. And some of these countries also have what we call sentinel surveillance for influenza-like illnesses and severe acute respiratory infections. So all these are available to help with the early detection of cases. The laboratory capacity for the countries to be able to confirm these cases is also there. And the issue of human resource capacity, yes, we have done quite a number of trainings for health workers that covers physicians, nurses, and other allied health workers on COVID-19, especially management of these cases. But some of the areas where we have quite a number of challenges, which is not just limited to Africa, but also globally, is the issues of supplies, the personal protective equipment that the health workers require, the issue of ventilators, availability of extra ICU beds to cope with further COVID-19 cases. But we have seen different countries making moves to expand the capacity for management of these cases. And we are also calling on all countries, because if the outbreak continues to spread, it means in addition to these equipment that you will require in the treatment center, you will also need additional human resource capacity to deal with the outbreak. So repurposing of the health workers that might not necessarily be in the hospitals right now, the experts we have that are physicians, nurses sitting in our public health institutes, we can also train them and get them ready in case we need them. We can deploy them. We can mobilize some of those health workers that have retired. We can also mobilize our medical students, student nurses to help support this effort. And globally, we can also encourage the North-South cooperation and South-South cooperation. So stronger countries that have more human resource capacity, for instance, in Africa, can support other countries, and globally, other countries where they have been able to manage these cases can also deploy health workers. We have a mechanism that is being coordinated by the World Health Organization. We call it emergency medical team, where you can pool medical teams from other countries to support and provide clinical care for patients when you are dealing with an outbreak such as this. So there are quite a number of things. Yes, we have challenges, but there are other issues that are strengths for Africa.
Thank you so much for joining us there, Dr. Mary Stevens, just speaking to us about some of the infrastructure and capacity as she spoke on the African continent to deal with the COVID-19 pandemic. Well, let's move to South Africa, which is adjusting to a new reality amid the coronavirus lockdown. While some are adapting to the measures, those suffering from mental illness are facing more challenges in doing so. There are fears that cases of depression and other psychological conditions could rise in the country. CGTN's Julie Shire brings us that report.
The streets of South Africa are quiet except for a few cars and people. The hustle and bustle has been replaced by an eerie silence and fears over COVID-19 isolation and financial commitments. It feels worse for those suffering with anxiety and depression.
There is a very real sense of loss. There's a loss of freedom, but there's also a loss of income and then that loss of personal connection, especially for people who stay absolutely on their own. I don't think anyone could have been prepared for this. It doesn't matter even if you knew about it ahead of time.
Anxiety is coming up quite a lot for many different profiles of people. More trickier of a profile is the mere fact that all the elements of the lockdown is really supporting the depression to actually get worse. And also because people that are depressed are less likely to be vocal.
Several interventions have been put into place by government for financial assistance. Banks have issued debt payment holidays, but for some it feels too much to bear.
I'm worried about the end of this month, how I'm going to pay medical aid, car, house. What are my kids going to do if my income stops? So it's very stressful.
Being confined at home is traumatic for most, but there are many online platforms now offering support. Social workers are also encouraging people to stay in touch with their clinicians if they're not coping.
It may be important to kind of just have a quick call with your provider and say, I'm not sure if this is seeing me through or holding me at this particular point in time, because we're in a more stressful environment right now.
For us to be in isolation is completely counter to our nature. So if you have the resilience, if you have the emotional wherewithal, reach out to people that you know need some help, especially the elderly. There's nothing at the moment that anyone can do to make the situation go away. But we can, as humans, use the technology to connect to people.
At least 16% of South Africans suffer from some kind of mental illness, and the mental health of the general population is likely to worsen as the lockdown progresses. Many are also coming to the realization that life may never return to normal. Julie Shire, CGTN, Johannesburg, South Africa.
Well, just as we had touched on earlier, a significant number of highly skilled medical professionals from Africa are heading overseas even as the continent battles the COVID-19 pandemic. They're mainly relocating to the West and other regions in search of better opportunities. The World Health Organization has warned that their exit poses a serious challenge to the health sectors in their respective home countries. CGTN's Kelechi Emekelam brings us that report.
A growing number of doctors, nurses and paramedics from Africa are making their way to Europe, America and other parts of the world. In Nigeria, for instance, the Medical Association reports that no less than 700 health workers leave the country annually for better pay. Nigerian doctors earn between $800 and $2,000 monthly, while their counterparts in the US could earn between $6,000 and $30,000 monthly. Their exit is putting a strain on the nation's health sector.
You have less doctors to cater for a large population of people. So for you to understand that properly, you could just go to any outpatient department in any government institution and see the crowds that are waiting to see a single doctor in a day, and you don't expect the best out of that doctor, that is constantly overstretched. We have a very poor patient to doctor ratio, based on WHO recommendations, and that doesn't give for effective healthcare delivery to the citizens.
More and more universities churn out student doctors every year. It takes about 6 years and thousands of dollars to train a medical doctor in Nigeria. 88% of them consider work opportunities outside the country. And that's mainly because they're exposed to poor working conditions exacerbated by deteriorating hospital facilities.
The working conditions for health care professionals in this country are quite deplorable. The pay, equipment and facilities to manage, to diagnose patients and manage them effectively are generally lacking in most health institutions across the country. This in itself is enough for one, after a lot of years of rigorous training, to seek greener pastures elsewhere. It's not just seeking greener pastures, but the job satisfaction also is generally lacking in Nigeria.
The WHO worries that Africa is ill-equipped to respond to the coronavirus pandemic, not far from the truth for a country like Nigeria with a ratio of 6,000 people to 1 doctor. A situation experts say calls for a state of emergency. They suggest government should pay more attention to equipping hospitals to world standards, increasing budget reallocations for the health sector, and improving welfare packages for professionals. Kelechi Amekalam, CGTN Abuja, Nigeria.
Well, it's time now for us to take a short break and return. More news making headlines, including shops reopen in Egypt after the government eases restrictions. And UK Prime Minister expected to announce lockdown easing plans as ministers say battle is far from over.
Each day, there are millions of stories. Each one can open new perspectives, new possibilities. Wherever you look, we are there. To see, discover, explore. We put the pieces together to find what really matters to you, all around the world, all around the clock. Our reporters are at home across the globe. From our headquarters in Beijing and production centers in Washington, Nairobi, and London, China Global Television Network. Stories from across the globe, reaching people across the globe. CGTN. See the difference.
It has been dubbed as the world's worst health crisis in modern history. The coronavirus pandemic is threatening to rip apart Africa's social and economic fabric.
Consider a risk are guided to a special facility where the entire flight get tested for COVID-19.
CGTN shares the struggles, the pain, and the anguish as African economies are moving to triumph over COVID-19.
Welcome back. You're watching News Making Headlines right here on Africa Live. Well, for the first time in a month, shops in Egypt have reopened this weekend. This after the government eased some of the restrictions. The authorities have allowed people more time on the streets, hoping that their outings and shopping will help the economy. CGTN's Adel El Mourouhi reports from Cairo.
Over the past month, shops in Egypt have been forced to close at night during weekdays and shut completely on weekends. These are usually the busiest sales times. Many have suffered under the COVID-19 partial lockdown.
At first, we used to sell a lot of disinfectant wipes and liquid, but not anymore. It lasted for a week and then people got bored. They are now staying at home and they have their stocks and the sales have now dropped. It's below the usual average. There are clients that I haven't seen in weeks. Those with kids are afraid to go out and they don't want to get infected.
This week, though, the government has finally lifted some of its restrictions. All malls and shops can now operate all week long until 9 o'clock in the evening when the night curfew begins. The first weekend has passed, but Hamdi says nothing much has changed for him.
It would have been better if I stayed at home. The entire market around me, if you take a look around, fruits, vegetables, any goods, no one is selling. People have been staying at home without work for over a month now. Where will they get the money? I expected things would be better, but so far they are not.
The Egyptian government is hoping that its relaxation measures in markets would help the economy pick up. That was evident in shopping malls that serve Egyptians with higher income than those at common markets like this one. But it appears some are still struggling. Adil Mahroui, CGTN, Cairo.
Chinese health authorities say they will intensify efforts to vet and monitor imported cases of the virus after the country reported only one locally transmitted case on Sunday.
In our circulated notices, we put forward the following requirements. First, we must improve the prevention against the imported cases for all the inbound travelers. We must have 14 days of mass quarantine and medical observation.
Also, we need to emphasize the efforts in all the stakeholders, like the customs, the border control, and etc., to ensure the closed-loop management. Also, we are to implement 4 measures and the monitoring at the fever clinics as well as the infectious disease reporting. We need to expand the monitoring scope and ensure that the close contacts, the asymptomatic infections, the inbound travelers, and the people in key sectors and in key institutions should be put under monitoring so that we can ensure the measures are in place. Also, we are to ensure the closed-loop management of the communities. Once there's a case of such community infection or cluster, we can quickly identify the reasons and curb the spread.
High school seniors are returning to their classrooms across China, but it's still not business as usual. Schools have put in place physical distancing and regular disinfection measures. In Beijing, class sizes have been cut to reduce the risk of spreading COVID-19. Some lessons have also been made available online for students staying at home. In Shanghai, nearly 150,000 students are resuming classes after receiving training on how to prevent the spread of the virus. While in southern China's Guangzhou, the size of each class has been limited to 25 students. In Hunan province, the students and staff received free testing before returning to school. The UK's number of confirmed COVID-19 cases has surged to over 150,000, with more than 20,000 deaths. It's believed, however, that Prime Minister Boris Johnson could announce plans to ease the lockdown as early as this week. He returned to Downing Street on Monday, 2 weeks after being discharged from hospital after recovering from the coronavirus.
Good afternoon. Thank you.
Meanwhile, in the UK, the death toll caused by COVID-19 has now passed the 20,000 mark. The country's government says it's working progress on a vaccine, but citizens have to practice social distancing for the rest of 2020. Nawid Jabrakal has more from London.
Scenes like this will be around for some time. That's the message from the UK's Foreign Secretary, who's currently heading the government. Dominic Raab says work is progressing on a vaccine, but that social distancing may have to remain in place for the rest of 2020.
So you talked about testing and vaccines, really important, and we're pursuing each of those at pace and at scale to make sure that we can deal medium and long term. But the vaccine wouldn't realistically come into play until the end of the year.
The UK's death toll has now passed the 20,000 mark. Ministers say the country's seen a peak in cases, but the battle on the front line is far from over. The UK government has faced a barrage of criticism over its handling of the coronavirus, and with Boris Johnson out of the picture, it's lacked both a figurehead and clear leadership. His return to work will be a boost for the government, but there are many issues he'll have to try and tackle straight away, not least the decision on when the UK's lockdown will be lifted. Scotland's already laid out an exit plan which could lead to further friction with London. There are also concerns about the rising economic damage caused by the lockdown. For now, ministers are avoiding giving an exact date of when the measures will be lifted, telling Britons instead to get used to a new normal. Luigi Barkil, CGTN, London.
Time now for us to take a short break. When we return, the business news, including Egypt's central bank eases restrictions on cash withdrawals. And Qatar Airlines staff take a 3-month-long half-pay cut as carrier remains grounded.
Images may appear to be identical, but looks can be deceiving. The difference is not always obvious. It has to be discovered. There are always different sides to a story. We put the focus on the details. To see more, to understand better. CGTN. See the difference.
It's time now for your business news. Egypt's central bank has raised the limit of cash that people are allowed to withdraw. The move comes almost a month after the government had limited withdrawals by individuals and companies. The decision comes at a time when Egyptians are spending more as the holy month of Ramadan begins. CGTN's Adel El Muruhi has that story.
Egyptian banks officially operate for fewer hours during Ramadan. That leaves more customers seeking other banking services outside the holds. With a cash withdrawal restriction placed due to the COVID-19 pandemic, the situation could have been worse if the limit was not lifted. But the Central Bank of Egypt has decided to increase the cash limits to lift pressure off banks.
With the COVID-19 circumstances in mind, the government wants to see a gradual approach to normal life. Ramadan has different scenarios. People's consumption increase, their spending increases, many engage in charity work and donations. That is the core reason for the central bank's shift in policy.
Holders of personal accounts are allowed up to $3,200 daily cash withdrawal, up from the $630 limit that was in place. ATMs are now allowing withdrawals of up from $320. The same limits apply to daily deposits as well.
The limits on deposits is not reasonable. It was implemented suddenly. It caused panic among Egyptians. Most of them are not ready to use electronic banking. The digital infrastructure in most banks remains weak. Online wires from one bank to the other could take up to 1 week.
Since Egypt reported COVID-19 cases, the country's central bank says it's been worried about transmission of the virus through banknotes. It has been trying to urge the public to use cashless payments. Even though it has restricted cash withdrawals, the bank has not imposed any limits on bank wires or for corporate accounts.
Increasing the cash withdrawal limits for Egyptians during Ramadan is a great relief. Public spending nearly triples during that holy month. Adel Mahoui, CGTN, Cairo.
Well, Kenya continues to record more remittances from its citizens working or living in the United States, United Kingdom, and the rest of Europe. Weekly data from the Central Bank of Kenya shows that remittance inflows increased to 228.9 million in March 2020, compared to 218.8 million in February. The cumulative inflows in the 12 months to March totaled 2.83 billion compared to 2.72 billion in the 12 months to March 2019, reflecting a growth of 4.3%. Available figures put total diaspora remittances to Kenya in 2019 at $2.54 billion compared with $2.45 billion the previous year. The increase is despite the effects of the COVID-19 pandemic on the global economy, which has cut such inflows from other countries such as South Africa, United Arab Emirates, Mauritius, and Oman. Qatar Airways has deferred payment of 50% of salaries for its mid-level and senior staff in Doha for 3 months with effect from April 2020. According to the airline, employees across all job levels, including overseas employees and junior employees, have taken voluntary salary deferrals in solidarity with their colleagues. The deferment comes after airlines around the world have been grounded in order to curb the spread of the coronavirus. Despite the suspension of international passenger flights, Qatar Airways' cargo business has increased operations to ensure the continuity of global trade and movement of essential medical and aid supplies, with almost 100 flights per day. Rwanda Air will also cut the salaries of its lowest paid employees by 8% and by 65% for its top earners. The carrier, which flies a fleet of 12 Boeing and Airbus planes to 29 destinations across 3 continents, has been one of the rising stars in Africa. In February, Qatar Airways said it was in talks to buy a 49% stake in the airline. Air Mauritius said this week that it has entered voluntary administration due to the crisis, joining Virgin Australia and South Africa Airways, who have called in administrators. Well, to the U.S. now, and more states are beginning to reopen their economies after weeks of stay-at-home orders, but questions and worries remain over whether it's safe to do so. CGTN's Owen Ferklow has more.
Nearly 2 months ago, Nashville and parts of Tennessee were ravaged by deadly tornadoes, a disaster soon dwarfed by COVID-19. Now parts of the state and a few others in the south and west are joining a handful by reopening businesses. But as this barber shop in Atlanta, Georgia, the first state to reopen, resumed business, some aren't sure it was a good idea, given patchy data from coronavirus testing across the country.
The stats on everything seem to be conflicting sometimes, so, you know, a haircut is not something I have to have.
As parts of the US start to re-emerge, President Donald Trump appears to be retreating a little. This weekend passed without a White House briefing he has led almost daily. Trump questioned their value after a storm of criticism over his suggestion, he says made sarcastically, that ingesting disinfectant might be a potential coronavirus treatment. His administration is now working on fresh stimulus measures amid dire economic forecasts.
I think that the next couple of months are going to look terrible. You're going to see numbers that are as bad as anything that we've ever seen. I think the unemployment rate is going to jump to a level probably around 16% or even higher.
So far, the US has spent nearly $3 trillion, about as much as countries like France and the UK make each year, to rescue the economy. Owen Fairclough, CGTN.
Time now for a short break and return. More news. We'll see you. Kenya's second largest slum, Mathare, which is situated in the capital Nairobi, is getting coronavirus-themed graffiti by a youth group campaigning to curb the spread of the virus. The campaign teaches people how to avoid contracting the COVID-19 disease.
Hopefully, the message will get home, and it will the people will be in a better place, you know, to protect themselves and also to protect their loved ones. So I feel humbled and privileged to be part of the artistic movement that's out here spreading awareness.
The idea of graffiti was basically to give people that message right at their doorstep, right at their setting, so that they know how to protect themselves, what is expected of them, yeah, and how they can make proactive choices that are going to make sure that COVID-19 does not spread.
Your sport news is coming up after the break. Here's a highlight. African football in limbo as COVID-19 continues its rapid spread.
How would you create your legend? On the fields, on the tracks, in the arenas of Africa. Were you born to be a player? Could this moment be yours? Sports Scene. Find your game.
Welcome back. Time now for your sport news. Well, most African leagues have been put on hold due to the COVID-19 pandemic. This has brought uncertainty on the completion of the fixtures amid a jam-packed calendar. CGTN's Duplessis takes a look at the effects of the coronavirus and how African football can return to normalcy once the pandemic is over.
The effects of the COVID-19 pandemic on African football has been severe. Leagues have been suspended until further notice, while the continental club competitions have also been delayed. There's a cloud over the AFCON tournament in Cameroon, and the 2022 World Cup qualifiers hang in the balance.
I certainly hope that we will be able to get back on track as soon as possible. But again, you know, this is the million-dollar question, because a lot rides on whether we can restart our leagues and whether the AFCON can go ahead on time. There's still a lot of data to be collected, and obviously first and foremost we have to make sure that countries around the globe, not only on the continent, are at a point where they can get down to business again.
According to reports, there's a chance FIFA could decide to scrap all international fixtures this year to allow leagues to be completed.
It's important that the leagues finish their programs, because some of the leagues, remember, they are also binded by the TV revenue streams, and if they don't finish their programs and they declare their leagues null and void for this season, it would have some huge consequences for them. Those repercussions could see them parting with billions of dollars.
So I certainly believe that we can finish the leagues behind closed doors, no crowds or spectators allowed, and then even then very strict regulations should take place within that team environment, because that in itself is a breeding ground for the virus. So extreme caution must take place within that environment for the league to continue.
CAF will have to adapt once the spread of the virus is under control in order to get African football operating at an optimal level once again.
When we come back, I think we're going to have some serious challenges, and I would urge CAF to be more open, to be more transparent in how they are dealing with this period, because it's going to be critical for football, especially economically, to respond to the challenges that we're having, because I foresee a very difficult situation post this COVID-19 pandemic.
The next round of AFCON qualifiers are set for early June, and at this stage it's highly unlikely they will happen. But with potential windows in August and September, CAF could find a way to cram in the fixtures in October and November, possibly squeezing in World Cup qualifiers too. Time will tell. One thing though is for certain: football will return and African talent will once again thrill crowds at stadiums all over the world. CS Duplessis, CGTN, Johannesburg.
The Spanish football season, halted like most major sporting competitions, is unlikely to return until the summer, according to the country's health minister, Salvador Illa. La Liga President Javier Tebas has been bullish about the need to complete the campaign in order to avoid collective losses of up to $1.08 billion and has given 3 potential restart dates: May the 29th, June the 7th, or June the 28th. The league has produced a protocol with strict guidelines for clubs to follow when training resumes, while Spain's sports ministry has also set out a plan for a return to action in closed stadia to boost the local economy. But in Sunday's daily coronavirus briefing, ILA was careful not to set any date for a return.
I cannot tell you right now if professional football will be able to restart the season before the summer. That would be stupid of me. We will see how things evolve, and we will follow the framework of the plan that we present. We all need to learn until a vaccine is created to live with this virus, which I reiterate is very dangerous, as well as an illness that people must respect.
In Italy, Prime Minister Giuseppe Conte has issued a go-ahead for professional sport to resume training from May. Speaking during a televised address, Conte had added that individual activities would begin on May the 4th, followed by full squad practices after 2 weeks. Serie A has been suspended since a nationwide lockdown went into effect on March the 9th. The league has 12 match days remaining, plus 4 other games suspended from the previous round. Defending champions Juventus are 1 point clear of Lazio at the top of the table. Serie A is expected to resume in June.
We will allow a progressive resumption of sporting activities with full priority for everybody's health. So from May 4th, we will approve training sessions for athletes, specifically those recognized by Italy's National Olympic Committee, as well as the country's sporting federations. But they must respect the rules of social distancing, avoid large gatherings, and stay behind closed doors in those particular sports.
In Tajikistan, the country's football authorities have acknowledged the threat of the coronavirus pandemic and postponed the local league. The Central Asian Nations Soccer Federation says games on Sunday will go ahead as planned before the league is suspended until May the 10th. The federation says its decision is in line with government measures to prevent the spread of the coronavirus. Games were being played without spectators. Tajikistan is one of the few countries which have not reported any cases of the coronavirus. Well, in boxing, as many countries still continue to keep away from the ring, in Nicaragua, an 8-fight card took place over the weekend. 16 professional Nicaraguan boxers got in the ring at the Alexis Arguello Sports Complex in an unusual evening of boxing. Organizers, however, took measures to combat the spread of coronavirus. Health workers checked the temperature of the attendees, disinfected their hands and shoes. The government has not implemented social distancing measures and is one of the few nations in the world where spectators still attend different sporting activities, including football and baseball. So far, Nicaragua has 11 cases of the novel coronavirus and 3 deaths, according to the World Health Organization.
At the entrance, they give us face masks. Then they clean your shoes and wash your hands and check the temperature by the assistants. I think they're controlling the situation so we don't get COVID-19.
We should not be afraid. We have to feel confident that the measures we're taking, such as hand washing and keeping social distancing, will ensure that we'll be healthy.
Well, that's it for this edition of Africa Live. Remember that you can send your feedback to the contacts on the screen and follow us on digital media platforms. From me, Hannah, Viviers, and the rest of the Africa Live team, thank you so much for watching. We'll see you next time.